Hurley Medical Center provides excellent care for the patients in this community and other communities by it being a level 1 trauma center.
We are a beacon of light for so many, not only within our small community, but also the entire Thumb area, Northern Michigan, you name it, we're here for you. We're the only level 1 trauma center, so we're dealing with the ones that are very hurt. And in addition to that, we have been voted the best hospital by My City Magazine. We were recently voted one of the top 10 employers. Not only do I say it, but we back it up. My name is Summer Jenkins, and I'm the Vice President of Human Resources. I've been here 13 years, and I am a great example of someone who starts at the bottom and rises up here within the medical center. I started as a benefits coordinator almost 13 years ago. From there, I became a manager within that time period and became the vice president about almost 3 years ago. Hurley Medical Center is the community. So not only are we providing assistance within our entire region, but the community works here. The community comes here for care. They are sharing their stories and bringing people in, whether it's from an employee perspective or a patient care perspective. Because if you work here, you want your family taken care of here.
I've stayed at Hurley Medical Center for 26 years because I love working with people. I love being an asset to help people to get what they need. I love the teamwork that we have at Hurley Medical Center. My name is Stacy Gardy. I'm the warehouse supervisor here at Hurley Medical Center. I started with Hurley Medical Center in 1998 as a transporter in the emergency department. I worked as a transporter for 12 years. I then advanced to a health unit coordinator. I then took over after that the ordering of supplies for the emergency department. After that, I then came to the warehouse as a bigger opportunity to be over more supplies than just the emergency department. My responsibilities within the warehouse is to ensure that once the products are received into the warehouse, that we get them properly distributed to the receivers, the people, the units that are in need of the items that we deliver. So we distribute all products with the exceptions of medications, which comes through the pharmacy. Any and every other product that enters this hospital comes through the warehouse receiving dock. We have 10 employees here that work in the medical center with over 100 years of seniority in combination. We work together as a team to try to ensure that the units have the products that they need to properly care for their patients. Hurley is a very family-oriented facility. When we meet one another, we automatically become family. But outside of our co-workers, I have had the opportunity to have many family members that work here. My mother retired from Hurley. My stepfather retired from Hurley. Currently, myself works here. My older brother works here. He is a team leader in environmental services. He's also worked his way up the chain. He has 29 years of seniority. I have a cousin that works here in the medical center and environmental services. And I also have my husband, who I met at Hurley Medical Center. We have been married for 15 years, and he also works here in environmental services. I've always wanted to work at Hurley Medical Center because of the family atmosphere, because of it being a city hospital. It gained my interest in the challenges of working at a city hospital, but also knowing that my mother worked here. She enjoyed her job here. She came in, she started at the kitchen. She got her sterile processing certification, became a sterile processor, and then with time, she became a supervisor within sterile services also. So I also seen the opportunity for growth.
I've always known about Hurley Medical Center since I was a kid. My mom did 20 years here, so I've always known about it, and then I'm from this area, so it's always been a staple in the area. So I've been here a little over a year now, and it's been rewarding, definitely. My primary job title is sterile processing technician, but in my department, I am the primary circulator, in which I coordinate my shift to make sure the operating room has what they need and make sure that the other techs are supplying what the operating room needs. I just recently been promoted to what is called the case card coordinator. So that is a liaison between the operating room and sterile processing. Even before that, I was able to move from third shift to first shift in less than a year, which is pretty unheard of. I definitely feel a family atmosphere around here because my department is in the basement, so all I see primarily is my coworkers. But when I come out of the department, everyone is so welcoming to me. They speak to me. A lot of people that I see every day, it seems like we're growing together as friends and colleagues. So it's very family oriented around here, definitely.
So I have stayed at Hurley for almost 10 years now. No other facility felt like home like it does here. We have a very family-oriented staff, not just with the nurses, but also with management and with our physicians. I am Christine, and I'm a nurse here at Hurley Medical Center. So during my 10 years at Hurley, I started off on 7 East on the medical surgical unit, and I took an opportunity on the new ICCU. When I was there for a few years, I transferred to ICU. When I came back, I actually came back as a house director, and then I took over 9 East as the nurse manager. So the nurse manager for the unit is in charge of operations for the unit. I make sure that we're staying on budget. I make sure that we have enough staff for each day and each night. I follow up with customer service complaints, and I also follow up with any issues that we may have with other departments or even within the department. Our culture at Hurley Medical Center is patient and family-centered care. We definitely like to wrap around our patients and their family members whenever we are dealing with them, either in the facility and outside of the facility.
You know, our vision is to create a healthier future for every child, adult, and senior citizen, and we put our money where our mouth is. We not only treat people when they are sick or injured, but we will find ways to help them stay in their homes, living that vibrant, healthy, active life. And we have Tarnisa Martin, AKA Nurse T. She is our Hurley's patient resource and community advocate, and the mission there is to improve the patient, family, and community healthcare experience through education, support, and advocacy. And she does that with boots on the ground. She's going out into the community, she's finding these individuals, and she's helping them at home, preventing them from having a stay at the hospital.
So I would definitely recommend anybody to join Hurley Medical Center. Even if you're just starting at an entry-level position, you can work your way up as long as you're in here.
You definitely will get all of the experiences that you need to go anywhere in the country from Hurley Medical Center. The nursing staff here does everything from wound care to education. You'll just definitely get an entire, full rounded experience here, and you have to be willing to be open-minded to that, so that way you can take in all of the things that you're going to learn here.
First and foremost, we provide world-class customer service to our employees here from a human resources aspect. In addition to making sure that we have the Rockstar benefit plans, we also do consistent market analysis to make sure that we're providing compensation that is comparable to organizations our size and with what we do. And just in regards to taking care of our employees that are here, we have employee celebrations. We have one full week in the summer where we just celebrate everyone within the organization. We have a Cheers for Peers where your colleagues can immediately give you attaboy for something that you've done well, and it's shared with management and leadership. We have our employee assistance program that provides all kinds of assistance to employees, but also from a mental health and social support. So truly the only thing missing here at Hurley is you. And we are waiting to connect with you. And in order to do so, you can reach out on our website, hurleymc.com/careers. That'll take you to all of our current openings. You can also contact our HR Service Center, which will connect you directly with a recruiter. That's 810-262-9140. And you can find us on all the social media sites, Facebook, Instagram, LinkedIn, you name it, we're out there. Just search Hurley Medical Center and we'll get together.
It's very important to me that we build off of what Hurley has already developed over the years, a very family, patient-centered facility. We need staff that want to be a part of that and want to stay a part of that family.